Hello, everyone. Welcome back. This week, as discussed, we'll be covering the Chapter 18, which is Coding Conditions of the Pregnancy and Postpartum. Let's have a look. And again, this is dealing with pregnancy, childbirth, and the puerperium or postpartum, if you will. And these codes cover O, letter O, 00 through letter O, 9A. And the first character of the code is the letter O as in obstetrics. It is not a 0. These codes are used on the mother's record. They don't appear on the newborns. Sometimes it's helpful to think of these codes in this kind of sequence. The very beginning of the chapter are pregnancies that end with an abortive outcome through O08. O09 is any type of pregnancy that needs to be supervised because it's high risk. And this goes back to the main terms that you'll see in the text and also in the alpha, pregnancy complicated by. We get into O10 through O16, and this is edema, proteinuria, hypertensive disorders in pregnancy, childbirth, and postpartum. Then we get into the 20s, other maternal disorders related to pregnancy. O30 through O48 is maternal care related to the fetus and amniotic cavity. O60 through O77, complications of labor and delivery. O80, O82, which we'll spend some special time talking about, are the encounters for delivery. O85 through O92, complications related to the postpartum period. And then we get into O94 through O9A, and these are other obstetric conditions not elsewhere classified. One other thing that is significant about ICD-10 codes for pregnancy is that it identifies the trimester of the pregnancy in which the condition occurred at the 4th, 5th, and 6th character level. This is summarized in 18.1. Let's have a quick look. So here's the figure that I wanted to point out to you. My apology for the delays. I was trying to circle certain items of this and it just wasn't working. So these are the category codes, right? So you can note here in table 18.1, Z3A00. This is weeks of gestation of pregnancy not specified. Z3A.01, less than 8 weeks. Z3A.08, 8 weeks, and so on. Codes for elective, either legal or therapeutic abortions, are reported with code Z33.2. Encounter for elective termination of pregnancy. Anything that's a complication of the termination of the pregnancy is found in pregnancy chapter 15 of the ICD-10-CM code book. ICD-10-CM requires the use of a 7th character extension to identify the fetus in which each certain complication codes apply. So another odd thing is we have 7 characters of 1 through 9, and these are for patients with multiple gestations. We use 0 when there's only one fetus in utero, which sounds kind of counterintuitive. There are a lot of notes in this chapter that direct the coder to do certain things, right? And code also, and all the things that we've seen in previous chapters. Normal pregnancies last for 266 days from the time of fertilization until birth, or 288 days from the last menstrual period till the birth. Anything that's before 37 weeks completed gestation is considered preterm. The delivery happens between weeks 38 and 40. Anything that's beyond 41 and 42 is post-term, when the delivery happens in week 41 and 42. When it's prolonged, delivery occurs when the pregnancy goes beyond 42 completed weeks. Here's another thing that we need to bear in mind, and that's mentioned in the code book and the guidelines. Trimesters are counted from the first day of the last menstrual period and defined as follows. The first trimester is less than 14 weeks. Anything 14 weeks to less than 28 weeks is the second trimester, right? So we go first from 0 days to less than 14 weeks. Once we turn 14 weeks until 28 weeks, it's second trimester. And the third trimester is 28 weeks until the delivery. The postpartum period begins immediately after the third stage of labor. And this typically goes 42 days or 6 weeks. And a postpartum complication occurs within that 6-week or 42-day period following the delivery. If the delivery occurs during the current admission, the diagnosis code for the patient's condition includes the option of in childbirth. We're going to use that code. When the classification does not provide an obstetric code for in childbirth, it's appropriate to assign a code describing the current trimester. And then we use a code from category Z3A, which is the code that category that tells us the weeks of gestation, to identify the specific week of pregnancy for the patient. And again, we always want to make sure that we're looking at the guidelines. This may be another chapter where you want to go to the website and download the current 2024 ICD-10-CM guidelines about this chapter. And some of the things you should be taking a close look at are the general rules for obstetric cases. This includes such things as what to code, the selection of the OB principal or first listed diagnosis, pre-existing conditions versus condition due to pregnancy, pre-existing hypertension in a pregnancy. There are also specific guidelines for fetal conditions affecting the management of the mother, and HIV infection in the pregnancy, which we touched on early in the course. But there's more. We also have diabetes in pregnancy. We have the long-term use of insulin, oral hypoglycemics, gestational pregnancy, sepsis and septic shock, postpartum sepsis, alcohol, tobacco, and drug use during pregnancy, poisoning, toxic effects, and all these other things, underdosing, what have you, in a pregnant patient. From time to time, this sounds very, very negative, but we have a lot of normal deliveries, and there are guidelines for that. We have the peripartum and postpartum period, how that is defined, the sequela of complications of pregnancy, the termination of pregnancy and spontaneous abortion, abuse in a pregnant patient, COVID 19 infection in pregnancy, childbirth, and postpartum. All these things are explicitly spelled out. As we talked about early, codes start in O as in OB, and the majority of the codes have a final character that indicate the trimester of pregnancy. And there's also the option for the coder to assign in childbirth code as well as current trimester code for the delivery. And again, if we go back to that page in the text, and we'll go back there in just a quick minute, a good main term is pregnancy. Pregnancy complicated by is a very common one. Pregnancy abnormal, ectopic pregnancy, examination, all these other things. Let's take a closer look at that set of terms again. And here we go again. These are two of the more important main terms you'll see very commonly: delivery and pregnancy. Everything in between these two check marks are subterms that will help lead you to the correct code. Again, going back to the main term delivery, which would appear in bold in the alphabetic index, there's specific subterms that show up for cesarean, completely normal, complicated by, breech, normal, term, vaginal, following previous C-section. All those things are under the main term of delivery. But what gets you off on the right foot is using the main term delivery. There is no entry in the alphabetic index for a main term of labor, only delivery. So if you keep looking for labor, labor complicated by, you want to look for delivery instead. Main term postpartum will refer you to puerperial. Subterms will describe the conditions within the onset of the postpartum period. When a patient is pregnant, the combination code for the pregnancy with the medical and often pre-existing condition must be used. And we'll get into some of those later. Some examples would be hypertension, diabetes, all these different types of things. And again, that summary of main terms and subterms in the textbook will be critical to help you out in this chapter. Codes from Chapter 21, Factors Influencing Health Status and Contact with Health Services, are used with these, and we have a couple of them. We have Encounter for Contraceptive Management. This is a code category of Z30. The main term for these would be contraception, contraceptive. And the other one would be Encounter for Procreative Management. Encounter, task, testing, or management would all lead you to the codes. And then Z32, Encounter for Pregnancy Test, Childbirth, Child Care. Again, as we saw when we talked about this chapter earlier, main term would be Encounter. If we have a woman who's pregnant and they elect to terminate the pregnancy, it's Z33.2. Z33.1 is the pregnant state incidental. Normally, with a female patient, we would want to code the pregnancy under all conditions. However, there are a few carve-outs with this. Again, the general coding guidelines direct us to code all conditions that are present at the time of the encounter, right? But on the other hand, while normally if somebody comes in the emergency room, they're in a motor vehicle accident, they're worked up, they have a ultrasound, what have you, to make sure the baby's okay, that's one thing. But what do we do if we have a woman who's pregnant, comes in for a laceration on her finger, she cut herself while she was doing some work in the kitchen or what have you? Again, if it's unrelated to and doesn't affect anything, going back to those general coding guidelines, doesn't affect the management, care, assessment of the patient at that time, we most likely would not code it. I hope that makes sense. Encounter for supervision of a normal pregnancy. These are like routine prenatal visits, right? Supervision of pregnancy. So the main term, once again, pregnancy supervision, and then the non-essential modifiers of or for. Why do we do it that way? Well, there are other ways you can find these codes, but the first listed code is going to be the reason that the patient came into the medical office. So even though they are pregnant, we want to code it. If they are coming in, it's for a normal prenatal check, that would be Z34. Likewise, in a similar vein, if a mother's coming in for antenatal screening, right, for preventative measures, that would be Z36. And again, main term, screening antenatal of mother. The weeks of gestation code, please pay special attention to this part because it gets complicated. It's used on the maternal record only. And the main term would be pregnancy, weeks of gestation. Again, that's important enough to say twice. Pregnancy, weeks of gestation. This is the main term here. Now we have an important concept that I want everybody to pay special attention to. And these are when we don't assign the weeks of gestation. And sometimes it's easier to think about the exceptions rather than the rule. And the three exceptions are we don't assign these Z3A codes for an abortive outcome, an elective termination of the pregnancy, or any conditions that occur during the postpartum, the puerperium. And the fifth character codes identify the weeks of gestation going from 8 weeks all the way through 42 weeks of gestation. And then finally, we have another maternal code, and this is the outcome of delivery. Anything that's outcome of delivery goes on the maternal record. This is different than the newborn birth, which goes on the baby's record. People get these crossed up. It's much more obvious in the real world because you'll be looking at a maternal chart, but the main outcome of delivery. And that's all I have for you right now. Come back, and in the next video lecture, we'll continue talking about some of the specialized coding that happens during the OB period, including such things as pregnancies and deliveries, multiple gestations, and some other important points. We'll see you then. Bye now.